This patient had a strange disease. His teeth looked. There was nothing wrong with his teeth, but the pain was endless every day. It felt like his head was about to explode. The dentist examined his mouth carefully. No cavities. No redness. He couldn't have been healthier. After studying for a long time, the dentist could not find the cause of the problem, so he could only prescribe a few painkillers. Let the patient hold out for a while. When he has worked out a treatment plan, then come back to the hospital for treatment. In the evening, the dentist is ready to close. At that moment, he saw that the sink had not been cleaned, so he went over to the sink. But when he got closer, he realized some bugs were floating on the surface of the water. He pulled out the leaky net to see. The drain was already blocked by worms. He thought back to the patient during the day. Could it be that they came out of his mouth? Thinking of this, the dentist looked at the patient's x-ray again. After searching carefully, he found that the roots of the patient's teeth, there were some filamentous objects wrapped around the patient's teeth. These objects could be the cause of the pain. In order to find out the origin of the worms, the dentist consulted his teacher, but he had been practicing for many years. He had never seen anything like this before. On the advice of his teacher, the dentist went to the library to check the information. After a morning of searching, he found out the name of the worm. Worm. It's a parasitic worm. They lay eggs near the host teeth. Then they move to the brain. The only record of this worm is a clinic in 1940. There's just no evidence that the tooth worm really exists. See this? The dentist immediately called, trying to arrange for patients to come to the clinic later to avoid being infected himself. However, the assistant told him the patient was already waiting at the clinic. There was no choice. The dentist had to put on a double mask to check with the patient. Soon, he pulled several worms out of the patient's teeth. He pulled out a few worms. The patient was indeed parasitized. Just at that moment, the patient's eyes suddenly turned bloodshot, as if there were worms wriggling around. Before the dentist could react, the patient fell to the ground, and then, next to the assistant, also suffered. Seeing this situation, the dentist got up from the floor. He hid in the adjacent operating room. He touched the wound on his neck and found that he was also infected. At that moment, the assistant was twitching on the floor. It looked like he was going to turn into a zombie. In order to prevent himself from becoming like this, the dentist grabbed the electric drill, ready to drill the teeth to remove the worms. However, halfway through the operation, he collapsed on the floor and kept convulsing, and eventually lost consciousness, turned into a zombie.